Good morning. This is David Henry, Communications Manager for the City of Amarillo. I want to welcome everyone to our COVID-19 news conference for the latest in COVID-19 information for the Amarillo community. Let me go ahead and quickly introduce who is on our panel here today. We're joined by Amarillo Mayor Ginger Nelson, Casey Stoughton, Public Health Director for the City of Amarillo, Dr. Todd Bell, Public Health Authority, Texas State University Health Sciences Center, Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. We're going to go ahead and open it up to opening statements from some of our panel members, and then we will take questions from our media members who are in attendance. Let's go ahead and start with Casey Stoughton, Public Health Director for the City of Amarillo. Casey, how are you?
I'm well, Dave. Thanks. Good morning, Amarillo. I just want to say a quick congratulations and good luck to all the teachers. Today was new teacher orientation for many around the Panhandle. So welcome back to school. Also want to say good morning to our new health authority, Dr. Todd Bell. We're certainly glad to have him on board. We appreciate the work of Dr. Scott Milton. And we're glad to have Dr. Bell with us. So just want to say those two things this morning. Lots of good work going on right now. And I know those teachers are preparing for our kiddos to start back to school. So with that, we'll talk about the numbers and then hear from our doctors and take questions from the media. So thank you everyone for being here this morning. As of yesterday, there were a total of 36,355 total cases of COVID-19 in Potter and Randall counties. Yesterday, we had an increase of 172 cases. We have 1,435 active cases, and we're up to 780 deaths here in our community. Since July 22nd, that's the day that we went to orange, we have increased by 989 active cases. So lots of spread right now here in Potter and Randall County. The 5-day new case average is at 129 new cases per day. We will remain at level orange for the next 2 weeks as three of the four metrics are in level orange. Yesterday, our GA34's hospitalization percentage was at 10.45%. So we're certainly increasing also on the hospitalization side. So it's important. Masking is important. Vaccinations are important. All of those prevention methods that we've talked about for so long continue to be important right now. August the 6th, Public Health will be moving from the Civic Center back to the Public Health Department on 1000 Martin Road, and we'll be giving vaccinations there at the Public Health Department along with back to school vaccinations. So if you need your COVID vaccine or your back to school shots, come see us. We'll be giving those vaccines there at the Public Health Department. And, I've had several people ask me over the past couple of weeks if quarantine is still required if you've been exposed. And the answer to that question is yes. So if you're not vaccinated or if you've not been fully masked, meaning that both you and the person who's positive were not wearing their mask properly, and that means over your nose and your mouth. So that's the way to properly wear your mask. If you weren't vaccinated or properly masked, then yes, you do need to quarantine for 14 days from the last time that you were around that person who is positive. However, if you're vaccinated, fully vaccinated, that means 2 weeks from your second dose of the Moderna or the Pfizer vaccine, or 2 weeks from the Johnson & Johnson, 2 weeks from the first dose of your Johnson & Johnson vaccine, or you're both wearing your mask, so you're fully masked, then you're not required to quarantine. You should, however, be on the lookout for any signs and symptoms of illness. And if you do develop any signs and symptoms of illness, then you need to isolate and call your doctor or public health so that you can be tested. So those things haven't changed. Still working through that with the Public Health Department, but just wanted to make sure that that you know what the best tools in the toolbox are for slowing the spread of COVID right now. It's best if you wear your mask if you've been exposed or if you're indoors, regardless of your vaccination status right now. And once again, it's time to come together as a community and push COVID back from the surge that it's making in our community right now. And that's all I have today, Dave. Thank you so much.
Thank you, Casey. Let's now go to Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Weiss, how are you?
Hey, good morning, Dave. I'm doing well. I just want to show this. So I have been Fauci. So this incredible gift was given to me by our newest chaplain, Scott, at the hospital here. So, but I'm wearing this tie to remind me to encourage you all to get Fauci, to get your Fauci ouchie or your Trump shot, whatever you want to call the vaccine. And the vaccine continues to be our single best weapon at preventing this virus from infecting us and replicating or reproducing. Because we know the more this virus reproduces, the more it has the opportunity to mutate or develop new variants that get around some of our best tools. Now, take for instance the Delta variant, which is now the dominant variant in our community. Thankfully, it has not learned to get around the vaccines, but one thing we know is it's developed the ability to be way more infectious. So they're saying now that for every one person with the Delta variant, they are likely to infect 5 other people, as opposed to the original COVID virus. If you get infected, you normally infected no more than 2 people. So it's gone from 2 to 5 in that sense. We also know, unfortunately, that this Delta variant has gotten around the bamlanivimab. Now that was the antibody that we were treating patients with as an outpatient. And we know that bamlanivimab will not touch Delta variant. Literally, we are having to throw away several hundred vials of that medication at the hospital because it's no good anymore. It's just not going to work. So again, as we continue to encourage people, the more we can slow the reproduction of this virus, the more we can control its mutations, its variants, and hopefully get in front of it. Let me talk about the numbers at Northwest, and then I'll give an update on numbers at BSA. I believe Dr. Lamatira, I'm hoping, is out on a long-deserved vacation. So right now, we have 31 COVID positive patients at Northwest. Now, that is 6.3% of our licensed beds, but that's actually 15.6% of the total number of patients in the acute side hospital. Okay, to put that in perspective, last Thursday, less than a week ago, we were at 20 positives. We are now at 31. We've increased over 50% in less than a week. Now, we have 13 patients in the ICU. We've actually had to open up an additional ICU now to accommodate the COVID positive patients. Right now, we're using 15 ventilators total. 4 of those are being used for patients with COVID-19. Now, as I said, we've also had several patients with COVID on our labor and delivery ward and in our pediatric ward. So we're seeing younger people contract this virus, including ladies who are expecting. Now, it's interesting, our outpatient testing. So on July 18th, we hit the first time we hit double-digit percentile positivity. We hit 10% positives on July 18th. We have been above that the entire time now. And yesterday, we were at 15% positives in our outpatient testing. So we continue to see more people test positive as an outpatient. One thing that's very interesting, I know Dr. Bell might even talk about this, is so when we test symptomatic people, we're doing a respiratory panel. That is a panel of a bunch of different viral tests. What we're seeing is some interesting results. Is one thing, we're seeing a virus called RSV quite frequently. Now, RSV normally is nowhere to be found this time of year. It's usually in the winter, and it usually affects kids. We're seeing it in adults midsummer, which is a very different issue. What the problem with this is we're seeing RSV, we're seeing other coronaviruses, we're seeing parainfluenza virus. It's like there's a party in our noses and everyone's invited right now. Okay, but what makes it confusing is now we're getting people with symptoms and we can't tell if they have COVID-19 or one of these other viruses. So we're seeing a lot of people ill with all kinds of viruses at this point. Now, in July, we had 5 people lose their lives to COVID-19. Thankfully, in August, we have not had any at this current time. We continue to treat people with remdesivir in the hospital. We right now have 10 people on treatment along with Decadron. Then another medicine that's maybe showing some potential is a drug called Tocilizumab. We mentioned this months ago. This is a drug that we use. It's an antibody we use for people with rheumatic diseases. Now, we're seeing anecdotally maybe some benefit to this medication. The problem is it's impossible to get. It is on back order, and we're on a national shortage of this medication right now. And then the biggest thing right now is in terms of our staff. So we have had 5 staff members test positive in the last 48 hours. None of those staff members have received the vaccine. Okay? If you look at our total positive patients, only 1 patient in the hospital received the vaccine. 30 of them have not been vaccinated. Okay? We have 16 staff in quarantine right now. That's a big concern. That number is going up, and those are valuable staff members for us to have outside the hospital not able to work. Let me just briefly talk about BSA. On Monday, they had 61 positive patients. Okay? Their numbers continue to go up. They actually had 13 COVID positive patients on ventilators. They had 26 in the ICU, and they had 17 of their staff on quarantine. When they were testing outpatient, they were getting a 27% positivity rate on Monday. So both hospitals are seeing the same thing. I think as the last message is, we've talked about the fact that there is a national shortage of hospital staff, particularly nurses right now. You're hearing all over the country about long waits to get into hospitals or hospitals on diversion. We are no different in Amarillo here. Okay? And I can tell you, if you come to the hospital and you are sick enough to be admitted to the hospital, you are likely to wait in our emergency room for quite a while for a bed. Okay? This is a major concern because we're 3 weeks away from school starting. And I anticipate we're going to see a lot faster move of this virus when school starts. And yet we are really almost at capacity in the hospitals in Amarillo and in Lubbock. So please keep yourself safe. Please do what you need to do to prevent getting sick. Vaccine, mask, distancing, everything. Because at this point, the hospitals are somewhat strapped to be able to take care of this surge of patients. That's all I have. Thank you.
Thank you, Dr. Weiss. Let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
Doing well, Dave. Thank you. So I'll start right with our numbers. Currently, we have 6 hospitalized COVID patients here at the Amarillo VA, 4 of which are in our ICU. And this morning, one of those was on a ventilator. I encourage the vaccination. Dr. Weiss talked about it also. When I look at our veteran population, we're at 43%, 43.5% of our veterans vaccinated that are enrolled to us throughout our healthcare system. We need to be much higher than that. And so we just continue. We do have the vaccine available. We continue to offer Moderna and the Johnson & Johnson vaccine. So I would encourage any veteran who wants to be vaccinated, please come by, let us get you vaccinated. That includes caregivers, spouses of veterans. We can vaccinate you too. And then I know the community has many opportunities to vaccinate also. The only other thing, positivity, I want to talk about positivity. Dr. Weiss had mentioned how they have watched their positivity go up. We also have seen the same thing. Right now this week, we're about 12.5% positivity, and yesterday was a little bit over 20% positivity. Now, last week, I think it was around 8%, and prior to that, it was less than 3% positivity for when we were testing veterans for COVID. So you can see that dramatic increase. And, not only are we seeing the same thing where our hospital has been full on many days, when those community hospitals are full, then we have nowhere to send our patients. And so you're seeing the same thing. You're seeing delays here in our emergency room because they're having to hold on to patients longer, trying to figure out where we can get them to get the care they need. The other thing I'll just say is, and this is on a much lighter and a much happier note, today is the United States Coast Guard's 231st birthday. And so just want to say happy birthday to all of our Coast Guard veterans out there. It's a small but powerful and very important service to maintain our seaways and ensure safety of our maritime vessels. And so, I just want to give a shout out to them. And that's all I have. And I'd like to thank the City of Amarillo for this opportunity.
Thank you, Dr. Gonzalez. Let's now go to City Manager Jared Miller. Mr. Miller, how are you today?
I'm good, Dave. Just want to remind everyone that we are currently operating under Executive Order GA38 from Governor Abbott. Want to call everyone's attention to his comments in GA38, where he says that Texans are strongly encouraged and have a personal responsibility to consistently follow good hygiene, social distancing, and other mitigation practices. And following up on the words of the medical directors, he also adds that we all are strongly encouraged, he strongly encourages all eligible Texans to receive a COVID-19 vaccine and to wear face coverings as recommended by the Texas Department of State Health Services and the CDC as an effective means of preventing the spread and mitigating the spread of coronavirus in our community. This is very important to us. As the doctors have said, our hospitals are at capacity already, and this is before we start school or anything like that for the fall. So we need to work together to be able to manage this and keep our hospitals able to take care of us, whether it's for COVID, for anything else. That's all I had, Dave.
Thank you, Jared. Now I'm going to open it up to members of our media. We have a question for an individual panel member or the panel as a whole. That's completely fine. Let's go ahead and start with, if I'm not mistaken, Kevin Welch of KFDA News Channel 10. Kevin, how are you?
I'm good, thank you. Casey, can you tell us about approximately how many shots you're giving at the city clinic now, daily, weekly, whatever number you have?
Sure. So, right before we went to level orange, we were seeing about 30 or so patients a day, and now we're seeing around 90 patients a day. So between 90 and 100. And so we're really glad that people are coming to be vaccinated.
And so this is a continuation of an uptick trend, right? Because last week you said it was starting to go up.
Yes. So in the last couple of weeks, we've certainly seen the numbers increase. So that's certainly good news. Okay.
What's the trend for testing requests? Seems like from the report card, it may be coming up.
Yes. So we've seen many more requests for testing. I think that's probably something that's similar to all of our clinics and hospitals. We've most days, all of our appointments are booked, and so we've had to even pull in an additional nurse to be testing.
Dr. Weiss and Dr. Gonzalez, is testing requests up for y'all?
Yes. So yeah, I'd say we got down to, I'd say probably about in mid-June, we were down doing 50, maybe 75 tests a day, and now we're 150 to 220 a day. And, part of it is we're really carefully testing a lot of people coming into the hospital, but overall, yes, testing requests are up.
Yeah, and I'd say the same thing here. We're seeing increased testing. I think by Wednesday last week, we had already hit our weekly total that we had hit the week before. And we're seeing similar. If I look at our numbers right now, we are well over half of what we did all last week. So we are seeing increased testing.
Okay. And for the doctors, what are the metrics that, and also Dr. Bell, metrics that you're watching to consider changes in policies and asking for help from the state? Would that be your responsibility, Dr. Bell?
First of all, thanks for the opportunity to be here. I think that that's a joint effort. It's one of the reasons that we communicate so well with our colleagues at the hospitals and in different clinics across the community, because there's a lot of things that go into that. When we're thinking about capacity, we want to not only be able to see what our current capacity is, we want to be able to, the best of our ability, predict what our capacity is going to be and what we're going to need. Because if we have a need today, it may be difficult to fill that need today. What we want to try to do is be able to predict forward. So the way that we do that, we keep a close watch on those things like ICU beds and ventilator rates and what's our overall hospitalization rate. Our testing percentage positive is actually a predictor of what our hospital strain or hospital requirements are going to be a week or two down the road. We know that these things come in an order, right? Somebody gets sick, then they test positive, then they end up getting sick enough to go to the hospital, then they end up getting sick enough to go to the ICU or potentially require a ventilator. So we try to put these things in order so that we're able to make some estimates and predictions of where we are further down the road. Now, at the same time, we also always try to see what resources we can utilize locally. We certainly want to be able to use those resources from the state when we need them and be able to anticipate those needs. But we also want to be able to flex and utilize as much as we can our own internal resources. And that's one of the things then that puts strain on the rest of the hospital system. Dr. Weiss had mentioned the fact that if you go to the emergency room and you need to be admitted, there may be a lag time to be able to get a bed for the ER. I was seeing a patient this morning down in the emergency room that had been there certainly longer than what is the norm because we're waiting for a bed to be available. Well, that's the part of the issue, is that COVID actually puts a strain on the entire healthcare system, not just on those folks that are directly taking care of COVID. So we as a community then really need to be working to try to pull together so that we're all contributing to the solution. And that goes back to what people have talked about, the importance of this multi-pronged approach of we want people to be vaccinated. That's our best tool. But we also want them to be wearing a mask because it takes time for those vaccines to be able to work. We want people to be doing that social distancing and giving people their space, holding events outdoors instead of indoors, trying to be able to find all those ways to decrease the spread so that we're able to preserve those resources in our healthcare community.
Okay, great. Thank you, everybody.
Thank you, Kevin. Let's now go to Dalton Williams of KBII Channel 7. Dalton, how are you?
Good. Thank you for having me this morning. My first question is, how much longer is this going to go on before we start considering ourselves like a high transmission area, or are we kind of already there?
Yeah, we're already there. We are a high transmission area. We're not making the national news. That's okay. We've got a lot of great things in Amarillo we should be on the national news about. Our transmission rate's not necessarily something I hope us to make the news about, but we are a high transmission area.
Okay, and then that kind of leads into my next question of, like, with Casey saying that vaccination rates have been a little bit up, are we doing anything to incentivize, are we thinking about doing anything to incentivize people to get a vaccine or wear their masks, or are we still just strongly encouraging it?
You know, Dalton, I think the best incentive there is not getting sick, not going to the hospital, not being put on a ventilator. Like, those are the very best incentives to be vaccinated. I think as far as, you know, monetary incentives, those types of things, we're certainly talking about those, but really the very best incentive is your personal health and the health of your loved ones and your family, you know, your friends and your family. So I think that is really the key point there is, and I think too, like, you know, we're competitive here in Amarillo, Texas. Like, we shouldn't be okay with the fact that there are other counties in Texas who have a better vaccination rate than we do. So, like, let's pull together and, like, we can beat the Metroplex in this. Like, this is an easy thing to be number one at. So I would encourage us to, like, be number one, because we can do that. This is easy.
Exactly. And then we've got 3 weeks until we're back to school. If things don't kind of turn for the better, how concerned are we that this may double, if not triple, for our cases?
I'll take a stab at this. First of all, please note that, like any time in epidemiology, the crystal balls are always murky, right? So it's really hard to be able to put a number on anything. What we would anticipate is that as we get more children, more adults, more people coming together, that's going to increase our rates of transmission. That's part of the reason that that personal responsibility that Mr. Miller mentioned and that the governor mentions in his GA is that we owe it to our community, we owe it to our children, and we owe it to ourselves to be using all the tools that are available to us. That's masking, that's vaccinating, that's keeping those social distances. Are we going to have an increase after school starts? Almost certainly. How much of an increase depends on what we as a community do to try to mitigate the spread of the virus. And I think that's where we're in a race against the virus. Right now, it's pulling ahead, but this is our opportunity to dig in and be able to do what's right to be able to overtake it.
Okay. And then my last question, I know Dr. Bell, you just literally just said that the crystal ball is kind of murky for the future and everything, but if we can get this going, do you think we could have go back to level yellow, down to level yellow by, say, October?
So when I said the crystal ball is murky, I should have said I dropped the crystal ball down a well full of hog poop. So the we don't know. I would guess, and this is purely a guess, is that our numbers will start coming down sometime in October. But that's not anything that we can plan on. And again, it depends on what we as a community do. If we pull together, if we're doing the right thing, both for ourselves, our family, our loved ones, and our neighbors and community, then hey, we may get this thing stamped back down faster. If we don't pay attention and we just treat this as just a everyday and people do their own thing and don't worry about their neighbor, then this could go on for longer. We just don't know at this point.
I also want to add on that, we have to recognize and acknowledge that our hospitals are at or near their capacity right now. The ability for our hospitals, and people might say, well, they can always ramp up just like they did last year. the ability for the hospitals to ramp up, I won't say it doesn't exist, but it's going to be far, far, far more difficult for them to do so because their available pool of employees and nurses that they need to be able to ramp up and step up operations like they did last time doesn't exist anymore, either because those people are no longer available, they have been tasked to other areas and are not available for tasking here, or for a variety of reasons. So we will, if we continue to have our hospitals be overtaxed, see more and more people being shipped to other locations. And if most of the country is experiencing what we're experiencing now, admittedly, we might be experiencing a little higher transmission rate and a little higher hospitalization rate than some areas of the country. We can expect to see our residents and people who need to be in our hospitals and want to be in our hospitals being sent to other locations. No telling how far away. So we really need to take very assertive, proactive steps to make sure that we can maintain our capacity at our hospitals for our local residents.
I would just say, really, Mr. Miller and Dr. Bell said exactly that. The concern is, please remember that at the height of the surge last year, we had all these visiting nurses coming through the Regional Advisory Council, the RAC, that were helping us. We have been told that that cavalry does not exist anymore. There will not be any nurses coming from the RAC or from the state. We've been given a list of a number of nursing or temporary nursing agencies. Just calling a handful of them, they have no nurses available. So that's our biggest concern at the hospital, is that cavalry's not coming in. We don't have that help that's going to come back us up. So we're really dependent on the staff we have and keeping those staff well and protected. And as you know, Casey and Ms. Miller said, when you talk about orange level, you're talking, the criteria for that is the hospital capacity. How many ventilators we have, how many ICU beds we have. You know, unless something changes, I'm concerned that with our staffing challenges, this could go on for quite a while in terms of trying to drop back to a lower level based on the resources the hospitals have.
Okay, awesome. Thank you so much. Those are all the questions that I have. Y'all have a great rest of your day.
Thank you, Dalton. Let's now go to Aaron Langston at KAMR Channel 4. Aaron, how are you?
Good. How are y'all?
Good.
Staying with the staffing questions, do we have a plan in place, knowing that the RAC is not available this year? You said the temporary nursing opportunities have no people available. So what is the plan going forward should we get beyond where we are?
Aaron, that's a challenging question, I'll be honest with you. We are talking about a number of options. What we're finding is in talking to some of the regional facilities. So we have a number of great community hospitals around Amarillo. For some of these hospitals, they actually have staff and beds, but they don't have the physician contingent, the expertise, like Dr. Bell or some of these critical care docs. We're actually talking to them about, if we could provide some of the physician expertise through telehealth processes, would they be willing to take some of these patients, knowing that they may have a little more available staff or beds than we do at any particular time? So again, no option is being disregarded at this point as to what's going to happen if we see a surge way beyond where we are right now.
All righty. And with the near capacity situation we are at, are we turning away patients, or is it just resulting in really long wait times?
Aaron, we are having to decline requests for transfers from outside hospitals, no doubt about it. And I can tell you, just talking to some of the regional facilities, they've had certain days where they've had a patient that needed a higher level of care, and unfortunately, they could not get that patient to either hospital in Amarillo or either the hospitals in Lubbock because of these same constraints. So yes, unfortunately, we are finding that we are having to decline transfer requests.
All righty. And with the number of staff that you're seeing go into quarantine that are unvaccinated, has there been talk of requiring staff to get vaccinated, or is that a possibility?
Aaron, there's talk. Lots of talk. Problem is, obviously both Northwest and BSA are owned by larger corporate entities. And so those conversations are really at the corporate level. And so I think, I can tell you there's a lot of strong consideration. And Dr. Bell or Casey probably know better than I do. but I'm hearing rumor that we may be within a week from having maybe the Pfizer vaccine fully approved by the FDA. I do think that a lot of these entities are waiting for full approval of those vaccines. And at that point, just like the influenza vaccine that we require for all staff, I think we feel more comfortable about saying at that point, we feel that we could mandate the vaccine for our workers to keep them safe and keep our patients safe.
All righty. And we're seeing that kids are being kind of the main ones affected by this Delta variant. Are we seeing more kids than we were before? And do you happen to have those numbers?
As a pediatrician, I'll take a stab at this. First of all, Aaron, I don't have any specific numbers for you. I do have my own clinical experience. What we've seen is that there is more pediatric disease with this round of COVID than what we've seen in the past. I don't think that that means that children are necessarily at greater risk than adults are. It's just that this variant is an equal opportunity infector. It is infecting everybody, regardless of age, whereas our original COVID variant seemed to primarily cause more severe disease in the elderly. At this point, our elderly population has done a really great job of being vaccinated. That's helping to protect them. So the patients that we're seeing in the hospital, the 5 COVID patients that I saw this morning in the hospital were all patients that were relatively young. Back last year, I would have been really surprised to have seen them in November because they were all too young to really be sick. Now, that's kind of who the typical patient is that we're seeing. So with that, we're also seeing more of the pediatric age disease as well. The good news remains that kids, for the most part, get over this and don't have any long-term problems or complications as far as we know from long-term, and are less likely to end up in the hospital than an adult would be. But we are still seeing more pediatric disease than what we saw earlier in the year.
All righty. And one last question. With this recent spike, are we seeing more interest in people coming to get the vaccine and more interest in people wanting to bring the mobile vaccine clinic to their events?
Yes, so we've, certainly increased vaccinations from around 30 a day to just around 90 a day, maybe, between 90 and 100. So certainly increases there. And we've had lots of opportunity to be mobile. So that's great. Lots of opportunity there. We certainly need lots more vaccinations being given. So it would encourage anyone who is not vaccinated to choose that vaccination.
All righty. I think that has been covered. Thank you very much.
Thank you, Aaron. Let's now go to David Gay of Amarillo Globe News. David, how are you?
I'm good. Good morning, everybody. I guess my first question is for Dr. Weiss. You talked a little bit about at the beginning about the bamlanivimab not being usable for the Delta variant. Does that also include, and forgive me, I can't remember the name of it, but the bamlanivimab cocktail that has been used previously in the past?
Yes, David. So we've stopped it. We called it BAMIT, so it was 2 antibodies. But knowing that one of them is worthless, we stopped doing that. The one that appears to be still worth giving is Regeneron, and that is a cocktail of 2 different antibodies. I know BSA's been given that. We've been given that. So we still have a tool to use in those outpatients that have contracted the virus. They're not sick enough to be admitted, and that we're trying to stave off them getting sicker and possibly hospitalized. So this Regeneron is what we are now using in that setting.
Okay, and just to follow up on that, the Tocilizumab that you were referring to earlier, is that has anecdotally shown kind of that it's treating the Delta variant as well as the other variants in the community?
Yes, and let me stress that anecdotally. So that was an interesting medicine. It appeared last year. There was a very good paper looked at. It was a big study looking at it, and what they found is that there was a very specific population of patients that seemed to benefit from it, and that you could gauge those patients by looking at what's called IL-6 levels, which is a cytokine, inflammatory cytokine. And so that's what we've been working on, is using it that way. So, but really, there's been no formal testing against the Delta variant that I'm aware of. But certainly, the physicians in our hospital that have been using this, are saying that they do believe they are seeing some benefit to this medication.
Okay, thank you for that. I guess my next question is to Dr. Gonzalez. I know that back a few months ago, whenever the other spike was occurring, that the VA began to take in non-veterans from Northwest and BSA. As the cases start going up and as the hospitals are more stressed, are there plans to implement that back in place, or are you guys just kind of staying put right now?
Yeah, so David, the way that has to work is the state has to request that, and then it goes to the VA, and the VA determines whether or not it's something we can do. I was told last week that some of those talks have already started, but as of right now, I have not heard that we've been approved to accept what we call fourth mission patients. But I do want to highlight right now our hospital is full too. So even if I had that approval right now, I would not be able to accept any.
Thank you for the clarification. I appreciate it, sir. And I guess the last question I have is for Mr. Miller. And excuse my ignorance on this. I know that the DSHS hospitalization rate was outlined in, I believe, Executive Order GA32, and there was a limit of 7 days above 15% that other restrictions started to be in place. Is that still the case in this new executive order, where if the Amarillo area does go above that 15% for 7 consecutive days, that more restrictions will be in place?
I do not believe that GA32 has been superseded. So we will have to review and get back up to speed on that, because we've kind of let that one go back to the wayside. But I think 32 is still effective. It has not been superseded by GA 34, 36, or 38. 34, 36, and 38 have significantly modified 32 with regard to our ability to require face coverings, with our ability to utilize Texas Health and Safety Code to require safe workplaces and things like that. So it will have a different effect now than it did earlier in the spring. So, but GA32 will still be in effect. We are quickly climbing that ladder. Yesterday, we were just over 8%. Today, we're at 10.45%. So it's moving fast as far as whether or not we are an area of high hospitalization as defined by the state, by the governor's executive orders.
So because of that climb of hospitalization rates, I guess our conversations, at least at the hospital level and at the city level, are talking about that possibility of once again becoming an area of high hospitalization by the state standards.
Right, and we're not the only part of the state that's going up like this. So this will be a topic of conversation, not only here locally with the doctors, with the public health authority, and with our hospitals, but also with DSHS, with the governor, and with our neighboring communities that are also facing the same challenges.
I think that's all the questions I have. Thank you for your time. Have a good rest of your week, y'all.
Thank you, David. This concludes our news conference for today. This is David Henry. I'm the Communications Manager for the City of Amarillo. Thank all of our panel members who took the time to provide this information today. Thank you for your time, and we'll see you by next time. Thank you.
Thank you.